that, especially on holidays. It's more and more, people, Christmas gifts and Hanukkah gifts and this and that. And my rule of thumb is very simple. If the person who comes in with the patient, she has to want a surgery or he has to want the surgery and not to be motivated by somebody else.
It's a really important point. And it's, so many times, the patient's happy with how they look and their sister or something says, all right, let's talk a little bit about, let's start with facelifts. We're going to go through the whole spectrum, but we're going to start with facelifts. Facelifts are the one that, is there one part of the facelift that gives you the best, like the best percentage? Somebody once told me that doing the eyes is 70 or 80% of the effect of a facelift.
Well, first of all, the eyes is not part of a facelift. Those in the central part of the face, very important to do them and to do them well. The answer to that question is no, because different faces age at different rates within the segments of the face. Somebody's face may age primarily in the middle segment, eyes and cheek area, with drooping of the cheek mount. Somebody else primarily would age in the neck. Somebody else forehead ages. So what you need to concentrate as far as that goes, and this is something, I'm briefly going to make a comment about mini lifts. And mini lifts have mini results at the expense of major scars. And as a general rule, you do the entire face, not necessarily in mini segments, in pieces. But what's important is you look at the area that's most age, and you try to get as good a result on that area as you possibly can, and then do the rest of the parts of the face to be now in harmony with that part. In other words, at times, for example, somebody comes in very bad middle third of the face, but the neck, let's say, it would be in this particular patient easier to rejuvenate. You over-rejuvenate that neck, you cannot catch up with the middle third of the face. So you have a disharmonious face after that, which will only get worse and worse as time goes on. But maybe this is getting a little too technical.
Let's start out and let's just look. People always wonder, where do you make the incisions for a facelift? And I know there are different types. So just start out and explain to them what are the possible incisions.
Well, very briefly, what we did here, I did a little diagram here showing the traditional forehead lift, which is often part of a facelift, which is an incision that goes all across from ear to ear across the top of the head. And then the incision is also starts in the temple and goes around the ear and behind the ear. And this is kind of the longest type of incision. This is what traditionally used to be done pretty exclusively. Nowadays we do facelifts with very different approaches, and I will briefly tell you about that in a moment. But again, there are still patients who need today the traditional approach on whom you have to do all these incisions. As far as the forehead goes, I no longer do traditional forehead lifts. I do only endoscopic lifts for the forehead, which have very short scars, and we'll talk about that in a moment. Now, another type of scar approach is what's called the short scar facelift, where the scar is only in the front of the ear, doesn't go behind. And this could be combined, of course, with an endoscopic lift. And I'm very proud because I was one of the people who developed the endoscopic lifts for the forehead and subsequently for the face some 12 years ago.
An endoscopic, and just to explain to our viewers, an endoscopic lift is through a small incision, and you undermine the skin and lift it up through this tinier incision.
Well, the best way to understand endoscopic approaches is very similar to arthroscopic knee surgery or take out your gallbladder endoscopically. When the incision is very small, you insert a small camera at the end of a tube, and then you look at the monitor as you do the surgery. And you have the field in magnification, you can avoid blood vessels and nerves. And here's the example on this little diagram where the scars are for an endoscopic lift. They're up here in the, let's flip to the next one because that has it in more magnified fashion. These are the only, you can see the red lines, this is where the endoscopic incisions are, all behind the hairline. Even the patient's hairdresser after a while can't find them. And through these incisions, the forehead can be rejuvenated, and then subsequently as the techniques evolved, now I can do an endoscopic facelift just through these incisions with no scars whatsoever around the ears. So if you want to, we can show some of the examples of patients with these various approaches.
Yes, one of the things you alluded to though, Peter, which I think is a really important thing, as patients are more sophisticated nowadays, and we've all seen patients who come in with a printout from the internet where they've researched, in many cases they know more about one little thing than we might know ourselves. But one of the mistakes I always felt patients made is to come in asking for the chef to prepare the salmon the way they would do it or somebody else would do it. I think a chef has to do his surgery the way he knows best how to do it. And in this case, I don't think you can go to a surgeon who does a traditional facelift and say, I want you to do an endoscopic facelift, because you want him to do the best job he can do. And so you should let, if you ask for a facelift, you should let the surgeon choose the one that he's most comfortable with.
That's a good point, but there are two things here that come to mind. One is the salmon example is good. It's even worse when the person goes to the restaurant and they wants a steak and they have only salmon in the back in the kitchen, so they cannot give him a steak or her a steak, and that's very true. But as far as what a surgeon should do, absolutely. A surgeon who's not comfortable doing a certain procedure should simply not do it and refer the patient to somebody else. What happens nowadays, though, there is so much out there about plastic surgery, and patients get very educated to the internet and otherwise. And unfortunately, and they are at a disadvantageous position, because also some of the stuff they read is very promotional. And it may be like, the only way to do a facelift to the short scarred facelift. And that's not the case. The way to do your facelift is what works for you. So the best surgeons will be familiar with all the different techniques. They have it in their armamentarium, and they reach in for whatever is best for that particular patient.
I remember once I had a patient come in and they said to me, do you repair detached retinas with intraocular lenses and the laser through ultrasound?
Right.
And I said, next.
Right,
all right, let's show some pictures, some real-life pictures here.
Which one
do you want to pick first?
We can start here. This is a traditional facelift.
Here's a traditional facelift. Tell us a little bit about it.
Here is a patient has major jowling, already a high forehead. You don't want to do any kind of forehead lift on her for obvious reasons, because you're going to raise her hairline more. We corrected her neck. I did also a little rhinoplasty on her, just the tip, which oftentimes droop as we age. We lifted the tip, narrowed the base of the nose a little bit, and that's her appearance before and after. Now, if you want to show a short scar facelift, here's a lady whose primary problem is in the neck, in the lower face. We did a short scar facelift, also did some liposuction of her neck, and put in a chin implant. And again, what we look for very much in my practice is to have a natural appearance afterwards. Now, if you can look at the next person, he's an interesting lady also, because on her, you can see the neck is bad. The middle third of the face has aged a little bit, the upper third also. So she had a combination with an endoscopic lift for the upper part, which is meaning the forehead and the middle third of the face, and the regular lift for the neck. That's the only way we could get her to go from this appearance to this appearance. Now, one of the advantages of the endoscopic lift is not only the fact that there's no incisions around the ears and no telltale signs whatsoever, but and also the recovery is faster, but also the results look more natural. Because through endoscopic approaches, from the incisions being behind the hairline, we can lift in a totally upward direction, as opposed to pulling backwards, which is the traditional lift we'll do, which gives this wind tunnel appearance.
Yeah, that's what I call the wind tunnel test. It looks like if you tap on their cheek, you can call Nairobi.
It's like a wind sweep, but here's an interesting situation. This is a lady who is actually in her mid to late 40s, and endoscopic lifts you can do at a very early age, because again there's no scar whatsoever. And I did an endoscopic lift on her face and her forehead, and did a little something to lift her eyebrows, and maybe you can zoom into this here, and also did her eyelids, and we got in general a fairly nice result. Now, her identical twin sister, at the same time, unbeknownst to me, went to somebody else who did a traditional forehead lift on her.
Let's just go switch over there. Yeah.
Putting an incision all across her head, from ear to ear. And if you look at her, her eyes are kind of surprised looking. Her eyebrows are a little too high. She doesn't look as natural. And when she came in with her sister, her identical twin sister, I operated on. I said, can I take some pictures of her? She was not very happy with her appearance, and we're probably going to be able to do something about later on. But redo surgery is always much more difficult than first time around. We can go on.
That's what I call the deer caught in the headlight look.
Yes, I didn't want to say that, but you can.
Okay.